PCOS, I feel, has become a rising symptom amongst many women. Many years ago, I don't think it was even something that people even knew. And now all of a sudden it feels as if every other woman may or may not have it. What is PCOS for those that don't know, and how do you know you have it?
All right, so PCOS it's to expand it's polycystic ovarian syndrome. Okay, so it's a gynecological condition where there's excess of the male hormone, so androgen. So it manifests in so many ways. You may have some excessive hair. When we do a scan, we may see that you have you may have what we call a string of pearl appearance on the ultrasound. So it manifests in those ways, okay? But then to say that PCOS is now on the rise, I wouldn't agree so much. What I'll say is that people are now vocal. There's a lot of awareness about PCOS now, and then people are being diagnosed more, because at first you may have someone, they are struggling to have a child, they are going through their normal life. You may have someone with facial hair, she's going through her normal life. Someone may not have any physical features of the PCOS, but she's going through her normal life. She's having her anovulatory periods. She's having her irregular periods once in 3 months, once in 4 months. She may not talk about it. She may not go to the hospital. She may luckily have 1 or 2 children, go on with her life. But now people are more aware. People, when they see any change in their body, or when they see or they experience any of these signs and symptoms, they go to the hospital. And women are being bold and vocal. They are talking about their issues. That's why I think we feel that it's on the rise. But I think it's not something there hasn't been a shift. We are just talking about it more.
Right. With PCOS, is it genetic? Do you develop it later on in life? Were you born with it? How does that work?
All right. So PCOS, well, I wouldn't say that it's genetic. There may be a familial history, okay? But then this is something that develops as you're growing. So when you are a little girl and you are born, there's no need to diagnose you of PCOS. There are no signs and symptoms that will lead to that. But as you're growing and maybe your periods become irregular, you see some facial hair, we notice that you have excess androgens, or a lot of people come in when they are struggling with their menstruation or their fertility. That's when we pick it up and see that, oh, okay, this is the diagnosis of PCOS. So that's how it usually comes about.
Okay. All right. Now,